you?
Hi, I'm Jill Manthorpe and I'm Director of the Social Care Workforce Research Unit at King's College London.
Great. How would you explain what you do to a layperson?
To a layperson, I think I would say that I work at a university and I research one of the largest groups of workers in England at the moment, which is the social care workforce. And so that means that I research people who provide care to vulnerable or disabled older people and other adults with disabilities.
Right. How would you define long-term care? What is it in your view?
To me, long-term care is a pretty difficult term because sometimes care needs can be temporary and sometimes care needs can be perhaps at the end of life, and so they're not necessarily long-term. But long-term care is quite a good umbrella term to describe the work of social care, and I suppose social care is the word that we use more often in England rather than long-term care.
Great. What would you say are the main 3 policy priorities at present for long-term care in England?
The 3 policy priorities, according I think to government and public opinion, are the funding of social care and indeed that interface with health services and other publicly funded social care services such as those coming from social security benefits. There's a sub-theme around that, which is how to sustain a high-quality social care service because we know that often services are not very good and people's experiences are very poor. And then lastly, there is that issue which applies to us all perhaps, about how people working in social care can be rewarded and can find the job that they do interesting, satisfying and indeed leading to very good outcomes for the people they serve.
Great. To what extent do you think these priorities have changed in the last 5 to 10 years, let's say?
I think in the last 5 or 10 years, the priority of social care research and indeed policy has been around that vexed issue of funding. And that goes back 50 to 60 years really, about the real way in which government decides that it will fund care for older people in particular, but also people who are born or maybe acquire disabilities in later life. So the priority of the government is indeed funding, but associated with that is everything else. It's about the role of families, it's about people's own responsibilities in that area, and it's about the role of the economy really in dealing with an ageing population.
So you bring up the economy. Do you think that the financial crisis has been having an impact on the long-term care system here?
Well, there are very interesting points to think about the financial crisis or crises in social care in England. First of all, there's the issue about counter-cyclical trends in social care, in that when people are fearful of their jobs, they may want to stay in work because it's actually there. Secondly, there's this issue about people worrying about cuts in services and the way in which people's support needs are being counted as less, and maybe the support they receive is lower, and that has huge impacts. And then lastly, there is the huge issue of the NHS in England and the UK generally, and the way in which often the NHS both takes up social care problems but also creates social care problems by perhaps providing very ill-tempered discharge from hospital and perhaps people not receiving the support they need from our health colleagues.
Jill, if you had the opportunity to introduce only one new policy reform, what would it be and why?
I think what I would try to introduce is a living wage for people working in social care. I think the social care sector has benefited enormously from the national minimum wage, but actually that's only a minimum. And to talk about the way in which we value people working in social care and we think that they should have a living wage really alters the debate, doesn't it? It's about saying that we so much value the people who are providing one of the most difficult jobs in society that we will give them a living wage and we will expect good care from them. It's not to say that we will give people a living wage and just respect poor practice. We will heighten our expectations, but in turn we will reward them financially and also by the status that gives.
Is this likely to happen, do you think?
I think that there may be some interesting debates going on. First of all, there's a debate about gender, and this is an area where it's highly feminised workforce, but also a workforce that is increasingly asserting that actually what it does is quasi-health or educational work, and so there will be interesting areas there. And I suppose that many of us who are approaching, or our own relatives are approaching social care, will begin to think about why it is that we want to have, or we accept lower quality standards and quality of care for older people and disabled people than we would for our children. And I suppose that's really one issue about that I found very helpful. If it's good enough for children, if it's good enough for young people, why isn't it good enough for adults who are called vulnerable adults? And one of the interesting things of working in social care with adults is that we're really very concerned to think about our future selves and our own relatives, in particular, 10, 20 years, that we too could be in that position.
Interesting. In your view, what is the most important piece of evidence that we're yet to address in terms of policy change in this country?
The most important evidence that I think we've got to address is what is called prevention. Prevention means everything, doesn't it? It applies to prevention of very low-level problems, prevention of things getting worse. I mean, people talk about primary, secondary, tertiary prevention and so on and so forth. And I suppose it's really thinking about what is the investment and whether or not prevention is actually what we're wanting. And for me, working with older people, prevention is very interesting because what we're talking about is death. And do we want to prevent death? And what does that mean? And perhaps we want to actually encourage a good death, or a death which is not accompanied by pain and distress and so on. So I think for me that area of prevention is one in which we need to disentangle the values and the other areas of emotion as well as policy and practice that to become encompassed within that concept.
Great. A few quick fire questions if you don't mind. Could you rate these between a 1 and 10? What policy priority is allocated to long-term care in your country?
The policy priority allocated to long-term care in England, I think, is about a 4. I think there are huge areas which are more important, or are seen as more important, such as the economy, such as the role of the public sector, and particularly education. So I think 4 is good. I think 4 is not to be seen as a failure, because clearly it's much better than the numbers below 4. But 4 is where I think it probably is.
Okay. How aware is the general public about the long-term care system and what it offers to people in need of care?
I think there's been increasing concern, and one of the interesting things I recommend to researchers is to make sure that they read a wide range of media, that they read newspapers that they wouldn't generally think of picking up. They can do it on the train, so they don't have to spend money on that, but actually they need to read newspapers to see what the public is concerned about, particularly the tabloids. And so, for example, if you took something like the Daily Mail, time and time again the Daily Mail is concerned with the quality of care of older people, about their care in hospital, about what's happening with people with dementia and so on and so forth. And I think we need to be very aware of those public debates that are happening, often outside academic circles, which is very interesting. And maybe the academics that these debates are talking to are often in medical circles, and perhaps for social care we need to articulate our perspectives much more clearly.
Great. How well do you think the system is supporting people with long-term care needs?
Long-term care needs is an interesting area. So I suppose if we took something like frailty or people with long-term disabilities, most people, I think, are very, very satisfied with what they get. And I suppose in academia you often turn to people who've got problems. But our research has shown through a number of studies that people value the personal relationship they have with care workers. They expect that their GP and their social worker will have their own interests and heart. And that's really very important and not always captured by academic studies that tend to focus on problems. So I think we've got a job in academia to reflect that highly nuanced view about social care, that long-term care, people actually respect it. And I suppose our interest in the media shows, in television and radio programmes, that actually people's experience is by and large quite satisfactory, except there are those big issues. And the big issues relate to funding and also paying for funds and also who you're going to fund. And if we perhaps get those key 3 themes a little bit more addressed by public policy, and it's not only a Department of Health policy, we may be a little bit more assured that the future for us all will be a little bit more certain.
Great. In terms of a scale rating, what would you give that, the way that the system supports people?
Well, I suppose we're talking not only about the way that the system supports people, but several systems. And one of the interesting areas from our own research is the way in which people who haven't got relatives and haven't got family members are largely a little bit adrift from the care services and from people's checking up that things are okay for them. So I suppose for a country like England, where there are larger numbers of people living on their own, and sometimes they haven't got relatives, not through anybody's fault or anything, but they just haven't got any family members, is what we are providing as a safety net for those individuals. So I suppose that's something that could be at risk of us all, that we will all perhaps end up perhaps with no relatives and our friends will have died. And I think we need to hear those views from people who are very much on their own, travelling that journey to death, about the way in which they're supported. So I suppose that's really, in a research term, an area that I've been increasingly interested in, is about people who are a little bit travelling this journey on their own.
Okay. And a scale rating between 1 and 10, how well does the system support carers?
The system supports carers fantastically for some carers and very, very badly for others. I've been a carer myself, and actually I don't think I had support from any professional whatsoever, and that was very disappointing. But perhaps I knew that there was some there if I wanted it. And so I think carers, it's very difficult to talk about them as a group. There are different carers and at different times, and I suppose for me as a carer, the one bit of support that I treasured was when a nurse brought me a cup of tea in a hospital ward when somebody was dying. And I knew the person was dying because the cup was china, and this was a big difference for me. I had usually had tea served in plastic, so you knew that something was going on. And I suppose what we're talking about is the nuances of relationship and the way in which people recognise carers in some respect, but also they don't. And I suppose family carers, particularly women, have got some of those very different relationships, both being advocates for the people they're supporting, having carers' needs their own, and also those people who are quasi-carers. They're not actually involved in carers, but they're wanting to make sure that the care, the person they're really concerned about, is happening well. And then there are people who are carers who are just exhausted, just burnt out, and we as society need to recognise that they're not failures, we shouldn't be giving them guilt that they're unsuccessful carers. They've done their best, and that's what they can do. So for all of us, we could all be carers, and today or tomorrow we could end up being carers, and I suppose that's one of the interesting things about life in the 21st century, isn't it, that we could all be in that position, and what we would want is very individually negotiated, but also we want society to assist us in what might be our possible role.
Great, thanks very much, Jill.
Yeah.